laser skin treatment, we are addressing the sunspots. And we've seen some improvement already from the first treatment. Okay? When doing this treatment, it's very important that you observe sun protection. Always wear sunscreen because it's going to defeat the purpose when you're just going to go out and have no sun protection. Ideally, if you love the outdoors, minimum at least 2 times a day, to apply the sunscreen. But by textbook, ideally should be applied every 2 hours. And there's a lot of work, so that's why I tell my patients just, at least twice a day. There's no downtime to this. How was your skin last time? Did you turn red or?
No, I just felt like I had a little sunburn.
Okay, so that's exactly how this laser works. It's a well-tolerated procedure, so I'm going to do a test spot. But overall, there's no significant downtime. You will hear loud popping sound. That's the pigment that will kind of blast. Okay, and certain areas that have hairs will be a little bit more sensitive, meaning to say higher intensity you will feel there because this laser discriminates no pigment. Anything that it sees, it will blast. Okay. You will notice the sunspots pattern in his face. It's really where the sun hits the face. Those cheeks, forehead. And the thing that I always tell my patients in Hawaii, especially here in Hawaii, there's always sun here, is the laser can just minimize the appearance of dark spots, but it will not prevent the occurrence. So just really be careful with sunscreen. So, how was it so far?
It's fine.
Anytime you work around the mouth area, I always tell my patients, if you have history of cold sore, it might trigger. Doesn't happen all the time, but in the event, either 2 things. You can pre-medicate if you have history. You go to your primary care doctor, get a prescription. Or, if it happens after you have no access to a prescription, then you can just do a topical arnica, which you can buy from any Whole Foods or down to here in Hawaii, or you can just do a Viva. You can get that from any pharmacy over the counter. Sometimes the patients may experience breakouts here and there after a treatment. That one is not a big issue. I always tell the spot treated area with benzoyl peroxide or salicylic acid. Some things that you can do to prepare yourself for the treatment if it's your first time is, if you're using any skincare products that have acid in it, lactic acid, salicylic acid, glycolic acid, stop 3 days before your treatment, 3 days before. If you're using prescription strength retinoid, then stop for about a week unless contraindicated by your dermatologist, just so we prevent irritation. You can resume your skincare products as soon as the redness subsides, and usually a day after the procedure. That's what I tell patients. Questions so far? How many times you have to come in? It's case to case. Ideally, I start with 3 to 4 treatments spaced out 3 to 4 weeks apart. And each treatment, I adjust the setting depending on the level of reduction in the pigment that I see. So I adjust the setting. But we have to be careful with laser setting because you can actually trigger if you have underlying or undiagnosed melasma. Melasma is a different kind of skin condition where you see patches, and it's very common for certain ethnicities. Usually darker skin color, we produce more pigment, and melasma is a tricky condition to treat. But in general, sun protection too, laser treatments, and some topicals can also help.